Good evening, everyone. I invite you all to CK's knowledge session on COVID-19 vaccination, insights, myths, and the way forward. We will start today's session with the welcome address. I request Mr. A.R.M. Arun, President, SICKI, and Chairman, Valigro Group, to deliver the welcome remarks. Sir, over to you.
Thank you, Bhavani. Dr. V. Balaji, Chair of SICKI's Healthcare Committee and Vascular Surgeon, Apollo Hospitals. Dr. P. Sendhu Nambi, Consultant Infectious Diseases, Apollo Hospitals. Friends who've joined us this evening. Wishing you all a very good evening. On behalf of SICKI, we welcome you to this most important knowledge session on COVID-19 vaccination, insights, myths, and the way forward. Starting my address, I'd like to share a quote from the 29th President of the United States, Mr. Warren Harding. He served during the early 1900s. In 1920, he won America's presidency and he promised the public to return to normalcy. This was immediately following the flu pandemic that took place from 1918 to 1920. During this time, he said, quote, "Our present need is not heroics, but healing, not nostrums, but normalcy, not revolution, but restoration, not agitation, but adjustment, not surgery, but serenity, not experiment, but equipoise, not submergence in internationality, but sustenance in triumphant nationality," unquote. Just about a century later, President Harding's goals and words sound more appealing, now so more than ever. It also looks frustratingly hard to achieve at this point of time. When we look at the road ahead of us, when exactly will this pandemic end? That's a question that's in everybody's mind. For the last 1.5 years, COVID-19 has gripped one country after another. Just when we think the virus is beaten, a new variant comes storming, more infectious than the last. We've been talking about the Delta variant for a long time, and now the Kappa variant is gaining a lot of attention, even though it was first discovered in May. In spite of this, in spite of the number of vaccinations having passed 3 billion, glimpses of post-COVID life are emerging. There are already two things that are clear. First, there will be subsequent phases of the pandemic with continuing pain. And secondly, COVID-19 will continue to cause a changing world. The Economist magazine recently published a normalcy index, which reflected where we were in our journey back to normalcy. Taking the pre-pandemic average as 100, it tracked such things as flights, traffic, retailing across 50 different countries that comprise 76% of the Earth's population. Today, the number stands at 66. From 100, we are now at 66. The good thing is we're almost double from April of last year. The index's worst performer has been Malaysia. They are suffering a wave of infections 6 times more deadlier than the January surge, and they scored just 27. The main reason for this is that vaccination remains highly incomplete. Vaccines are certainly very, very important. The development of safe and effective COVID-19 vaccines is a huge step forward in our global effort to end this pandemic. This also enables us to get back to doing more of the things that we enjoy, along with the people that we love. Although COVID-19 vaccines were developed in record time, the process has not made the systems for testing, assessing results, and approving a vaccine any less rigorous. The vaccines we have with us are certainly safe. We have in our hands one of the greatest tools in the history of human health. Going forward, we suggest for the government to follow through upon 3 important points. First, drastically increase the production of these vaccines. We should be doing this at least now, so that we have enough to vaccinate our people, as well as we can do whatever we can to assist the world. Second, vaccine research has to be able to continue to tackle new variants that are coming about even faster. And third, we have to have clear schedules to roll out vaccines among our states so that our states can be well prepared ahead of time and firmly execute their respective vaccinations. We have to jointly ensure zero wastage at all costs. When we choose to vaccinate, we are not just protecting ourselves and our families, we are doing our part to create a safer community and a healthier future for all. It is certainly going to take time for enough people to be vaccinated and for us to reach herd immunity. This is why it's so important to continue to follow the safety measures even after we get vaccines. And these measures include wearing of a mask, keeping physical distance among us, as well as practicing frequent hand washing. We would also like to take this opportunity within SICI to suggest to our state government to have all bottleneck areas within our healthcare value chain looked into. Wherever we need to, we have to be able to plug the gaps at the earliest. It's better to have this done now and not wait any further. Oxygen has been one area, and glad that the government has taken concrete steps towards this. We have to necessarily have our capacities, not just oxygen, but across the board within our healthcare system, to be large enough to handle surges in numbers and not just maintain status quo. Another area of concern is that of misinformation. Misinformation is one of the biggest challenges in fighting COVID-19. Knowing the facts is key to being properly prepared and protecting ourselves as well as our loved ones. This is why SICI has taken the lead to organize this important session today. We are certain that this session presented by senior doctors will be extremely useful in presenting facts and importantly the way forward. I'd now like to share a few words with you about SICI. During the pandemic, we have led the way in converting challenges presented by the pandemic, turning them into opportunities. We dare to go beyond webinars and have been working on multiple projects, knowledge reports, as well as furthering our flagship programs. Let me share with you a few of our projects. Our over 24 sectoral committees have been propelling industry's need forward, along with proactively engaging with the government. Second, SICI has been working with Guidance Tamil Nadu to engage in the Tamil diaspora outreach. Our flagship YO conclave was attended by over 4,000 participants from over 38 countries. Next, we launched the monthly discussion series, SICI 360, which features high-profile guests who share their insights on all facets of their life and achievements. Session 10 of SICI 360 is scheduled to be held next week. That's July 23rd, which is a Friday at 4:30 p.m. We are glad that Dr. P.C. Reddy of Apollo Hospitals has agreed to join us at this time. We request you to please mark your calendars and join us online. Another program that we've been working on is that of the Sister Cities Desk along with the Chennai Corporation. The idea here is to connect Tamil Nadu cities with the cities of the world. We are also working with the Department of Culture to build an industrial museum in Egmore. Last but not the least, another project we've been working on is that of readers' lounges, setting up readers' lounges at the Chennai Metro Rail stations. With those projects and in closing, would certainly like to take this opportunity as well to appreciate my colleague, Dr. Balaji, for his efforts with SICI's Healthcare Committee. We certainly look forward to more such events from our Healthcare Committee for the benefit of society as well as the healthcare industry at large. We would like to appreciate all participants who have invested their time and effort in this program. We thank you all for being with us today and look forward to your continuing support in the days to come. Thank you.
Thank you, sir, for your warm welcome. We have invited Thiru Ma Subramanian, Honorable Minister for Health and Family Welfare, Government of Tamil Nadu, to be the chief guest of today's session. However, owing to his last-minute travel, he is unable to join us today. He has sent his regrets, and we hope to have him in our upcoming sessions. I would like to invite Dr. V. Balaji, Chair, SICI Healthcare Committee, to set the context for this evening session. Dr. Balaji is a senior vascular and endovascular surgeon in Apollo Hospitals and adjunct professor in TNMGR Medical University. He had done his fellowship in pancreas transplantation at University of Minnesota, Minneapolis, USA, and in endovascular surgery at University of Cologne, Germany. Dr. Balaji is the first overseas Indian to pass FRCS Inter-Royal College Board exam. With these words, I welcome Dr. Balaji to take over the session. Sir, over to you, sir.
Thank you, Bhavani, for that nice introduction. Thank you, President, for giving that wonderful intro to set the context for this meeting. Today, it's very, very pertinent, and I feel it's a very, very relevant and a hot topic, as many, I'm sure, all our participants will benefit out of this. I thank Dr. Nambi to be participating in this event and kindly agreeing for this meeting. The topic of the day is insights, myths, and the way forward in the COVID-19 vaccine. My dear friends, as you know, COVID-19 has been going through whole of the around the globe. Started somewhere in December 2019 and affected millions of people around the globe. Fortunately, it's the first in the history of medicine we could get a vaccine in a very short time. Previously, I believe mumps was the one which was the vaccine was came into production within 4 years, and this time within 10 months we could have a vaccine. But as you know, there are a lot of debates and deliberations and controversies when it came to, mainly because of it was approved on the emergency scenario. I'm sure, as our president said, vaccine is the only solution. It is not just a vaccine, it is a vaccination. I think people should understand that nobody is protected until everybody is protected, so that we all develop the herd immunity. Also, interestingly, as far as looking at the Indian scenario is concerned, India used to be the top of the vaccine industry. It used to supply nearly 70% of the vaccine to the whole globe earlier. And that is the reason we could set the ball rolling immediately, even though Western countries like US and UK started vaccinating early. Our production started quickly, and we have started early enough in compared to other countries. Even though the number of vaccine is not enough, the speed at which we are doing it not good enough to vaccinate nearly 1.3 billion people. To clear lots of whatever questions, we have with us Mr. Nambi, who is a senior consultant at Infectious Diseases Department. He did a postgraduate fellowship in Apollo Hospital. He's one of the first to get the diploma of fellowship in infectious diseases. He's also got a certification from the Royal College of Physicians from London. And he heads the Infectious Diseases Committee in nearly 12 hospitals of Apollo Hospitals. And I would say he's one of very few in the country who's got extensive experience in the management of COVID, and hence the vaccine which goes along with that. Good evening, Dr. Nambi.
Good evening, Dr. Balaji. Thank for you for giving me this opportunity, and thank SICKI and its president for this opportunity.
Dr. Nambi, just to set things going, I would like to ask you some basic questions so that I think a lot of participants, I think we have an extra crowd here. Let's start with something very basic. Vaccine. We know that there are two ways of treating a disease. Either you have a curative treatment, like in the form of, for example, any viral disease, you have antiviral drugs, or if you don't have a vaccine, is the only way of doing things. For example, for HIV, we could never find a vaccine. We had anti-HIV drugs very quickly on board, so we could, control the disease. Unfortunately, in COVID situation, we have a vaccine in hand. Can you tell us briefly about what do you mean by vaccine and the history of vaccine, how it evolved, and where do we stand now?
Vaccines, as far as the common man is concerned, probably I'll put it as a miniature form of the infection. So any infection, it will be a virus, bacteria, when it comes from outside, the body's immune system is equipped to or prepared to handle the infection, be it a virus or bacteria, whatever it is. If you look into the immune system, there are two kinds of immune system. One is known as the innate immune system. For example, the skin that we have, the mucosa, whatever the covering that we have in the nose, throat, the gastrointestinal tract, these all constitute the innate immune system. That is, we are born with that in addition to the WBC count. So any infection or any pathogen that comes from outside, the innate immune system, the skin, mucosa, and the WBC, they generally kick in as quick as possible within seconds to minutes, and then they kick in for the initial 4 to 6 hours. Then you have the adaptive immune system. Adaptive is something that develops after the pathogen, the virus or bacteria, when it enters into the body, and in which you categorize into T cell and B cell. B cell immune system will produce antibodies, whereas T cell will produce certain cells which would recognize the pathogen. So if there is a future infection, it would help in re-recognizing the pathogen and taking care of it again. So when you introduce a vaccine, what it means is you introduce a miniature, milder form of the infection, the original infection, to the host. As a result, the immune system is primed to recognize, and it mounts some kind of an immune response to the pathogen. So when the real infection happens subsequently, the already primed immune system is in a geared mode to clear off the infection. To put it in an even more simpler fashion, this is like preparing for the final exam. So you have a lot of mini exams to take together, or it will be the battlefield, major war when it happens. Prior to that, you train yourself by physical training or getting hit or some kind of minor trauma that happens that prepares you for the worst battle. So vaccine prepares one's own immune system to handle when the infection happens. So that's what a vaccine does. And if you look into the history of vaccines, in addition to chlorination of water, if you look at three things that have saved most number of lives in the last 120 years, one would be chlorination of water, and then second thing would be always vaccines. So these two things, in addition to antibiotics like simple drugs like sulfa and penicillin, these three things have had the major impact in terms of the number of lives saved in the history of mankind. A disease like smallpox, probably I'm not sure about the age of this audience, but probably someone less than 40 may not know about smallpox. Anyone who's more than 45 years of age would have had an experience with the smallpox vaccine. There would be always elders in the family showing that mark of that smallpox vaccine. It's a deadly disease, with almost 30% mortality. There are 100 people with infections, 30% would die with smallpox. Whereas with COVID, it is not that high. It is actually less than 1%. A deadlier disease like smallpox is not there in this world. That is because of the widespread use of vaccine for the majority of the population in the world. Another disease like polio, which would affect the small children, the neurological system, the muscle system, whatever it is, and they develop some paralysis. Polio was affecting major countries in Africa and Asia, and India is one of those countries with huge polio burden. Now India is polio free. So that is because of the widespread effort by the World Health Organization, the UNICEF, and the Indian government, plus a lot of other non-governmental organizations pitching in. So when you had the pulse polio immunization program, because of that, polio is no more. So vaccines have had major impact in eradication or wiping out diseases or keeping diseases under control. And this is not something new. What we need to know is most children who are born are given vaccines. And so most children get vaccines. So this is not something new that is done only in the elderly population. So it has been in vogue for many, many years. Diseases like smallpox, polio are not there in the world because of the vaccines. And it is one of those biggest public health measures, in addition to the use of antibiotics and chlorination of water. which has had major impact in the number of lives saved in the history of mankind.
Oh, yeah, it's very interesting. Nabil. I mean, as I said, historically, from Edward Jenner's pox vaccine to where we are today, we have so much that uh, we are able to conduct this very quickly. And there are so many vaccines for both bacteria and viral diseases. So the COVID vaccine, how we could find a solution so quickly? Is it because we were up to date with the vaccine or vaccinology or vaccine technology already? Or is it that things have become so easy that you can change your methodology in manufacture of the vaccine? How is it, within 10 minutes, we were able to get into this so quickly?
I think that was the biggest surprise with COVID. No one expected a vaccine in a span of 8 to 10 months. And that is because of two important reasons. This was the global call. So it was a huge pandemic affecting the entire world. Another thing was China, the first affected country, shared the genome sequence of the virus to the WHO and other countries quite early in the course of the pandemic. So once the genome sequence was available for the other member nations to work on, that made things easier. And in a traditional vaccine development for other infections, generally takes around 8 to 10 years because vaccine development goes through phases where you have preclinical studies to start with, and then you have the clinical studies where you have the phase 1, phase 2, phase 3 studies before licensing is made. The preclinical study and phase 1 generally focuses on the safety, whereas the phase 2 and phase 3 studies looks into the efficacy part. So what happened with other infections was you would start the preclinical study, then do the phase 1, then do the phase 2, then do the phase 3. So everything had a span of around 8 to 10 months. So it was all done in sequence. So you had a gap of around 7 to 8 years before the vaccine could be available for public use. Whereas with COVID, what was done was once the preclinical studies were done, you had the phase 1, phase 2, phase 3 happening concurrently, happening parallelly. And that kind of changed the way that we could get the vaccine very quickly. It was not done in succession or sequence, it was done concurrently or parallelly. So that kind of fast tracked the vaccine production, design, and you need to have some kind of information, basic information with respect to safety, because the fundamental principle of medicine is to do no harm. So whether we benefit or not, you should not do any harm. So the safety aspect was something that was looked very keenly, and once the safety aspect was kind of looked reasonably well without any issues, then the efficacy studies were done parallelly so that you could get the information in a span of around 6 to 7 months, and then gave the approval part. So that is a difference in which COVID vaccine was worked upon. So we have a vaccine for COVID, which would be the best way to prevent COVID in a span of 8 to 10 months. And probably China shared the genome sequence quite early. So that is also equally important because many of these vaccines had newer technologies like the RNA vaccine, DNA vaccine, for which you need to know the genetic sequence of the virus. So unless you have free access to the genetic sequence of the virus, it's very difficult to work on the vaccines.
Yeah, it's again very interesting because we are all locked up during the lockdown. We were wondering how we are going to come out. We were waiting for the vaccine. The moment the vaccine came out, people are quite reluctant to get the vaccine because they're quite suspicious how this got into the market so quickly. That paradoxically, that's a reason probably some delay in procurement and vaccination, etc. Maybe do you think that's one of the reasons?
It could be one of the reasons, and I do agree. In the early part of 2020, when we had COVID, the commonest question asked to us was, when would the vaccine come? When would the vaccine come? And when vaccine got approved in the UK for use in December 2020 and in January in the US, and January 16th, 2021, we had the vaccine available in India. And then the question was, is this vaccine good? Is it safe? Is it efficacious? The same minds what asked about the vaccine, when it will come, now is asking, is it safe? Is it effective? And it is a kind of a strange phenomenon. So you seek for something, and when it is available, you question its validity and eligibility. And that's something probably unique to our population. I would put it that way, because if you look into the vaccine coverage in most of the Western countries, it's been fairly good when compared to us, actually. So that is where we stand. And people have their own doubts regarding the way the vaccines were produced. So they have in their minds whether these vaccines were fast-tracked, and whether I am used as a guinea pig to test the vaccine. But what we need to understand is, if a vaccine like Covishield or Covaxin is licensed for use in India, there have been thousands of volunteers who participated in the clinical trial. Okay, you have to keep that in mind. There are sacrifices of volunteers. So it is being tested on volunteers, human volunteers. And there are many people who are known to me who took part in Covaxin trial or Covishield trial. And in fact, they had a much bigger sacrifice attitude towards the whole problem. And we have to respect the sacrifice made by them. They took part in these vaccine trials without any kind of benefit. You cannot have any monetary benefits as per law for taking part in any clinical trials. So they did it for the benefit of humanity. There were many Indians, there were many Americans, and many Britishers who have all took part in vaccine trials. They took the gamble, and I think we should try to reap the efforts and sacrifices of human volunteers who had bravely took part in the vaccine trials. And I think we should respect their sacrifice. If we see it from that angle, then I think things will be much more easier in accepting the vaccine.
Okay, coming to the types of vaccines, as you know, for India, we started having first the Serum Institute of India started production, so-called this AstraZeneca Covishield, and then biotech started producing Covaxin. Before that, we had Pfizer technology and Moderna from US, which was licensed earlier. As you know, now, after that, now I think we started importing from Russian technology. Sputnik V is available, and we are expecting second generation vaccines. Before that, we believe China itself had some vaccines, which was around some part of the world. Obviously, some countries didn't use that. So there are different technologies, different techniques used in the manufacture of vaccines. Why is that there is no coordination amongst the scientific community globally, so that we can come up with the best vaccine? Or do you think all of them are similar, or better to have a competition among the companies to come up with the better ones? Or is it because of the convenience different companies started producing their own vaccines?
I think the need of the globe was a vaccine. And if you look into the companies that you have mentioned, the methodology or the technique behind the vaccine production is different for each of those companies, to be frank. And this was an opportunity for all those pharma companies. One is to serve the humanity. Another one is trying to make some profit out of it also. So let us keep that in mind. So there was a competition for a good cause, and you had different mechanisms by which these vaccines, the research was done. For example, Covaxin, which probably is an indigenous vaccine produced by India. You have the Bharat Biotech. The seed virus was given by the National Institute of Virology, Pune, and Bharat Biotech, in collaboration with the ICMR, Indian Council of Medical Research, New Delhi, came up with this Bharat Biotech's Covaxin, which is an inactivated virus. The virus is in an inactivated form or a dead form. The key component here for the vaccine to work is the spike protein of the virus. So the spike protein of the virus is presented to the humans in different forms. Whereas in the Covaxin, it is displayed in the inactivated virus, the spike protein. Whereas if you look into the Sputnik or the Oxford vaccine, Sputnik is the Russian vaccine. The Gamaleya Institute has come up with that. The Russian authorities have collaborated with Dr. Reddy's of Hyderabad, Dr. Reddy's lab, and they have the Indian licensing for manufacturing the Sputnik vaccine. And then you had the Oxford University in collaboration with AstraZeneca, which came up with the AstraZeneca vaccine, Covishield. The Serum Institutes of India, Pune, they took the licensing for producing the vaccine for India and plus few other countries also. The Sputnik and the Oxford vaccine, the AstraZeneca vaccine, the Covishield, that is a vector-based vaccine. So what is a vector? Vector is something that carries something, that carries the pathogen. So that is called as a vector. So what was done in this vector-based technology was the spike protein, DNA or RNA, is packed into the vector, another virus. The another virus is actually the adenovirus. So you had the coronavirus spike protein placed inside another virus, the adenovirus. So the adenovirus carrying the spike protein of the coronavirus is injected into our system by means of the vaccine. So when the adenovirus multiplies, the protein material, the spike protein, the DNA, RNA coding for that will multiply, and then your immune system recognizes it. In the Covaxin, the protein is coated in a dead virus, whereas in the vector-based vaccine, the Covishield and the Sputnik, the spike protein is embedded into another vector. The vector is actually adenovirus, another virus. So it's a totally different methodology. And then you had the mRNA vaccine. What is this RNA? RNA is nothing but the genetic material. So the genes code for the protein. So the genetic material has that codes for the protein. Instead of putting into a vector, it is introduced directly into the human system. So that is the mRNA vaccine. So you have the Pfizer, which is a US-based pharma company, the biggest pharma company in the world. They had the technique, and then you have the Moderna. The Moderna vaccine is in collaboration with a German company called BioNTech. So there was a Europe-US collaboration there. So they had the Moderna vaccine. Both the Moderna and Pfizer vaccine are mRNA-based vaccine. So the mRNA or the RNA or the genetic material that codes for the spike protein is introduced directly into the system. And then you have the DNA vaccine. Zydus, the Indian company from Ahmedabad, they already have into the phase 3 trials. That is a DNA vaccine. The DNA that codes for the spike protein of the SARS-CoV-2 virus will be introduced directly. So everything has different avenues. Probably it could be, I would put it this way, if your vaccine-induced immunity is the sea, there are many rivers reaching the sea. So you could try to travel in the river that you want to do. It could be Kuvam, or it could be Godavari, it could be Krishna, or entering into the Bay of Bengal. So whatever it is, you could try to choose the river. The ultimate aim is the vaccine-induced immunity, just like many rivers would go and finally enter into the sea. All these were different avenues which multiple different companies chose to invest upon, and so that they could have some competition among themselves. So since it is not a government driven or a public health thing like a World Health Organization driven, so the government did not take initiative on its own. It will be the US or the European nations or the World Health Organization. They all supported major private pharma companies to invest in research and come up with some product in a short span of time. So that is how these vaccines have been evolved.
Okay, Mr. President was mentioning during his introductory comment that, as you know, the virus has already started mutating. We knew about this mutation near about 7-8 months ago. But these vaccines, the technology and the research was a year ago. How good is our technology in catching up with a quick mutation? Is this the one we have now is enough for any number of mutations, or the technology has to keep improving or changing as we go along? Because we already started from alpha to today lambda, and we are not changing the vaccine. How long before we should look for a next generation of vaccines?
What we need to understand from a virus standpoint is mutations are way of life. So if nature has brought this virus into the circulation, there is already a debate into it, how the virus brought into the circulation. But from a virus standpoint, it deserves to live. So it would always try any method so that it would survive, infect many people, multiply and replicate in various cells so that it could keep living on. So for that, it would keep changing its phase, the phase with which it chooses to attack humans like us. So it would always keep changing in phase so that our immune system would not be able to recognize the changing phase. And how does it change its phase? By mutations. So mutations are way of life. Let it be viruses, bacteria, any other pathogen. So even in our body, our cells also keep changing. So we have to understand that. And if you're coming back to the mutations, has it gone at a much higher pace than the vaccine research? It looks certainly to an extent, but most of the vaccines that are currently being used have a reasonable amount of coverage for all kinds of variants, let it be alpha, beta, gamma. So no vaccine means zero immunity. If you take up a vaccine, definitely it does offer some kind of protection, if not the best possible protection. The mRNA vaccines are naturally designed in such a way that you could tweak the genetic material, the RNA, so that you could probably have a newer set of vaccine produced in a quick fashion that could counter the major variant. If there is a big change, for example, if alpha changes to Z variant, and Z is something that is going to predominate the world, and if the existing vaccine is not going to prevent us from getting Z variant of the virus, so the mRNA vaccines are designed in such a way that you could tweak the vaccine research process quickly so that you could have new vaccine manufactured in a span of 4 to 6 weeks. Whereas the other platforms like the vector-based vaccines or inactivated virus vaccines will take some time. Whereas the RNA-based vaccines, it can be tweaked quickly so that you could counter whatever change the virus acquires for trying to prolong its survival. But it's always a challenge. So that is why it's not only vaccines, it's about using masks. That is also equally important if you're looking at probably having a balance with respect to normal life. So probably in addition to vaccines, wearing mask is also very, very important. The social distancing in a country like India of 138 crores, I don't think the social distancing is practical in our country. What would work is only mask, and then what would work, probably keep your hands clean and then take vaccine.
Okay, that's good. Now I'm going to ask you something very, very practical, and probably most of our viewers would like to ask you this question. We have now quite a vaccines on your plate now. You never had this choice, for example, for a polio or so. When they asked you to come for a polio, you just went, had one, and came out. And today, you're coming up with so many. In fact, people are waiting for the next one. When am I going to get the next one? I'm waiting for the Moderna to come. Now that we have few vaccines available to us, especially in the private sector, what is the difference? I mean, technologically, is it the difference? I'm talking about safety and efficacy aspects. Of course, the complications. This is what most of our viewers will be interested in. Do you have any comments on that, Nambi?
I think what has been widely available in India is Covishield and Covaxin. And in the last 1 month, we have Sputnik. And as you had already mentioned, Moderna may be coming to India. And this is where we stand. Probably we would have 4 vaccines. And in general, what we need to understand is 2 doses of the same vaccine at whatever specified intervals. Covaxin, it is 4 weeks interval. And then with Covishield, it is 12 weeks interval. 2 doses of that. It's always better to follow vaccine A with vaccine A at that interval. And then you're looking at immunity or protection 2 weeks after the second dose. So that is the natural progression. So if you ask me what is common sense is, if you're taking vaccine A, always take vaccine A as a second dose. And then probably wait for further information to come 6 months down the lane, saying that should I take a booster dose? Will that booster dose be the third dose? Will it be the same vaccine that I had taken earlier, or can it be combined with some other vaccine? There is information available, for example, with the AstraZeneca vaccine, the Covishield actually. If you have taken Covishield, probably you can follow it up with either Pfizer or Moderna vaccine. That is where it stands. So do we have such kind of information for Covaxin? No, we do not have that information. What about Sputnik? If I have taken Covishield, one dose, can I take Sputnik as my second dose? We do not know. So if you have taken Covishield, take Covishield as a second dose. And if there is, after 6 months of time, if there is another vaccine like Moderna or some Pfizer vaccine is available, can I take it after my Covishield? Right now, with whatever information that we have, Covishield, after taking Covishield, you could take either Pfizer or Moderna. Whereas with Covaxin, we do not know because it has not been looked after so far, because Covaxin was an Indian vaccine. So it was not studied in the UK or Europe or the US. So that is where it stands. Perhaps as time flies off, we are in a dynamic situation. So with treatment, COVID treatment, things took a U-turn to what it was in 2020 to what is there in 2021. And the same with Covishield, gap between the first and second dose. Initially, it was 4 weeks, then it was 8 weeks, now it has become 12 weeks. So, but what we need to understand is from a public standpoint or an industry standpoint, whatever is being done, it is done for the betterment. It is being done with an eye on keeping pace with evolving science. We have to keep that in mind. If the public or the industry views that recommendations that comes from the government or some other scientific body with suspicion, then it becomes a problem. So we could combine AstraZeneca with other vaccine like Pfizer or Moderna. That is where we stand with the information at this point of time.
Another important question what my patients always ask is there any group of patients, barring, of course, children, they have not gone through any trial, so nobody is recommended vaccine in children. In adult population, is there anybody who should not take vaccine very strictly? Because a lot of patients still, they're quite hesitant. I have this problem, that problem, that's why I'm not taking, I don't want to take it and things like that. Just to clear the mind so that the good message goes around the community. Is there obviously we want a universal immunization so that we get a very quick herd immunity. Is there anybody who should not take vaccine scientifically?
I don't think there is anybody who should not take the vaccine. So the only contraindication is someone has taken the vaccine and developed a bad allergic reaction, anaphylaxis, immediately after taking the vaccine. So immediately after taking the vaccine, their blood pressure drops or they have breathing difficulty. So that you would know only after taking the first dose. If that happens, then you're not taking the vaccine again. Otherwise, history of food allergy or history of allergy to other drugs like sulfa, penicillin does not stop us from taking the COVID vaccine. And many a times, if I ask my patients, why is that you're not taking a vaccine? They would say, I'm a cardiac patient, I've got diabetes. These are the very same reasons why they would require the vaccine. Someone with diabetes requires a vaccine. Someone with hypertension, someone has a kidney problem, liver problem, heart problem, strokes. They are at much more risk of developing severe pneumonia due to COVID. They are the ones who needs to take the vaccine. The very same reasons, what is there in the minds of a common man, saying, making him think not to take the vaccines, are the very same reasons why they should take the vaccine. The only reason why someone should not take the vaccine is they have severe allergic reactions immediately after taking the first dose of vaccine. That does not happen, then all of us are an ideal candidate to consider vaccine, and then we should opt for vaccine. All the more we have to understand that India is the #2 country, the whole world, in terms of the number of infections. The official estimates is 3 crores. That is the number of infections. We are the #2 country in the world. And the game is not over for us. And if you look into the number of fatalities, even though our fatality rate is less, the number of people who have died, if you look into the overall numbers, it is 4 lakh Indians have died because of COVID in the last 15 months. No other disease has killed so many people in a short span of time. So if we are an Indian And we are the number 2 country in the world in terms of the number of infections. We are the number 3 country in the whole world in the number of people who have died. Then what more we have to stop us from taking the vaccine? We are not in New Zealand or Australia living in an island where we can restrict so many things, or where you have a sparse population and then it is spaced out. We are 139 crore people packed into a small mosque, the world's 7th largest country, and with a high population density. So we have all the reasons to take the vaccine. And only reason why we would not take is when you have taken a first dose, you have developed a very, very severe allergic reaction. Otherwise, there are no contraindications, medical contraindications.
I think that is a very strong message, Navneet, so that I hope this message goes around. I think all adult population, except this allergic scenario, should have a vaccine. But not to forget about some of the side effects of patient, which has been publicized widely in the media. That's another reason I think a lot of people are quite hesitant in taking the vaccine. Do you have any comments about it?
Yeah, I think in a way, media has its own plus and minus. So it has helped in spreading the good news about the disease, as well as misinformation and bad news. What we need to understand is any kind of therapy. So whatever we do, any medicines that we give, let it be an allopathic system or Ayurvedic system, Siddha, there is no medicine in the whole world which would come without any kind of side effects. I don't believe in that. So if there is a medicine, there has to be an effect and there will be some kind of side effect. So we have to keep that in mind. So always you look into the risk versus benefit. If a medical body or a treating clinician wants to give a medicine, then always the risk versus benefit is kept into the mind. Only when the benefit is going to be much more than the risk involved, then a person is going to advise, or a government is going to advise, or a doctor or a hospital is going to give you the vaccine. So all these questions have been answered mentally by experts before it is being recommended as a wide scale. We have to keep that in mind. Having said that, this is a new disease, it's a new vaccine, so more information would be available in the post-marketing studies, because the vaccines were approved in a short span of time, 8 to 10 months. The safety was the prime focus in the preclinical and the clinical studies, stage 1 and 2, but the stage 4 is actually the post-marketing data. So that is where the vaccine is really tested out in the wild, where huge numbers of population are being exposed to the vaccine. So you're likely to get much rarer side effects being picked up, because in a trial, if you're looking at some 70,000 people taking the vaccine, whereas in a real life situation, in a country like India, now there are around 37 crore people have taken the vaccine. So this is a real life situation. So it is magnified. What is being in a trial is magnified in a real life situation. So there are concerns with respect to the side effects. The commonest side effect that you have with the vaccine is pain at the site of injection. That happens with any intramuscular injection, leave alone the vaccine. You're going to take a painkiller intramuscular. You're going to take a paracetamol intramuscular. There is going to be a pain associated with that. Similar kind of pain can be associated with the vaccine. Since vaccine is a miniature version of the virus, your immune system would try to recognize this vaccine virus as something else. So it would try to clear it off. So how it would try to clear it off? When it happens, there is inflammation setting in your body. So people are expected to have some fever, mild fever, body pain, joint pains, headache. This is nothing but our immune system trying to take control over the vaccine virus. So we should feel happy you're going to develop all these things. It means that the vaccine has the virus particle in a miniature version, and the immune system is trying to take care of it so that it can recognize it. So when the real infection happens sometime later, it would be in a speed mode. It has already recognized it. So it would take care of the infection very quickly. So these are minor side effects that are expected with any vaccine. All we have to look into is if we have children at home, there are grandparents, all they have to look into is the grandchildren. Parents, they have to look into their children. Most kids will get vaccines at birth, 6 weeks, 10 weeks, 14 weeks. Children, when they get the vaccine, they would have swelling at the site, they would have fever, and they would be crying. So or that they cry because of pain. So the same thing will happen to an adult. So how is that in the children? You're able to accept that the vaccine, we can accept pain, incessant cry, we can accept swelling at the site of injections. We got a BCG, there will be a scar for the kid there. Then we give the DPT over the thigh, and most of the children who get the DPT injections would have a small swelling happening over the thigh. Somehow our mind is conditioned to accept that is a norm for the kid who gets vaccinated. The same thing when it happens to an adult, we question it. We think, overthink, and create unnecessary problems in our mind. So these are all minor side effects that would associate with any kind of vaccine. Most of our children have gone through it. We as children have gone through it. So no vaccine would not, there is no vaccine which would not produce some kind of reaction. There will be fever, there will be pain, there will be swelling, there could be headache. All these are all part of a normal expected course. But there are some other rare side effects of these vaccines. One of those rare side effects is the blood clots. So that has been observed with both Covishield and Covaxin, more so with Covishield. So there is data emerging from the Europe and UK saying that the younger population, let us try avoiding the Covishield, more so in the women. So if you look into the risk of blood clots, with blood clots happening in your brain, blood vessels, some other part of the body. Blood clots is a favorite area of Dr. Balaji. He is a vascular man, so he would know it as good as me or better than me, definitely. So if you look into the risk of Covishield producing blood clots, it is 0.5 per million. So if there are 10 lakh vaccine doses, you're going to have 0.5. So with every 20 lakh vaccine, there could be one person developing a blood clot. So if you look into the same kind of mishap happening, so if you're going to run a long distance marathon, 7 out of 1 million will have some problems. If you're going to do any other kind of adventure sports, the risk is much higher than the 0.5 that you would attribute with the vaccine. So it is 0.5 per million. I think that number is still small, even though it has been focused and talked upon. Another rare side effect with the RNA vaccine is myocarditis. The heart valve, the heart muscle goes in for some kind of inflammation. That is with the RNA vaccine, the Pfizer and Moderna vaccine. But the side effects at times gets glorified, and then it is seen with a magnifying glass. You need to look into the main effect. The main effect is the protection that you're going to get. The numbers are very small. It should not discourage us from the widespread vaccination that the country aims to achieve.
Thank you, Nambi. That the message is loud and clear. Like any other vaccine, these vaccines also have complication, but that is not a reason not to get vaccinated. By vaccinating, it's not only helping yourself, you're helping the community. Before I start taking questions from the floor, I have two quick questions. I think at least one, a lot of people are waiting to hear from you. It's nearly 16 months since we've been locked up. Everybody wants to travel outside for vacation, seeing family, for business, for medical conferences. Now that you're vaccinated, what is going to be the scenario when you have had both the vaccine, you are supposed to be immunized? What is the current status in the international travels scenario now?
I think that's a pretty valid question. So all of us would like to be a free bird. That is what we are trying to aim at. What we need to keep in mind is having 2 doses of the vaccine is very, very important. Another fact that we need to remember is no vaccine is 100% protective. So we have to keep that in mind. But what vaccine does is prevents you and me from getting hospitalized because of COVID. Look into that factor. So what does a vaccine do? Does it prevent infection? It may or may not. So it would still, you may get infected after taking the vaccine. But what does it prevent effectively, very effectively, is more than 99% of people who have been vaccinated, let it be Covishield, Covaxin, or the Pfizer, Moderna, Sputnik, whatever it is, the chance that they're going to get hospitalized in the ICU or the chance of mortality is actually very, very less. It's almost less than 0.05. So that is something that we have to keep in mind. Vaccines will not prevent infections. So we have to keep that also in mind. It prevents severe disease. It prevents hospitalization due to severe disease, it prevents death. So that factor is more than 99%. So when we travel, yes, we have to keep that in mind. So in addition to vaccine, what we'll have to focus is on using masks. It's very important. I don't think we can throw away the mask and go for a free travel unless the country or the place that we choose to go does not have a major numbers. If it is in a very low numbers, then that's fine. So taking vaccines is actually very essential for travel. In addition to that, the basic travel etiquette and food hygiene, plus focusing on the masks. Masks is very important in addition to the vaccine. So if as long as you are having a shot and putting your mask on, I think all of us are safe. And that is what most doctors and nurses do. So we take the shot and then we put the mask and then we handle COVID patients. So from where does the small nurses who weigh 40 to 50 kilograms, from where do they gain the confidence? All their confidence that they get is because of the mask that they use. That is how we worked in the first wave. We didn't have the vaccine at that time. We were just focusing on the use of the mask and the protective equipment. And now with the vaccines, there is a little more liberation. You feel that, okay, you've been vaccinated, so you are expecting not a rough course with COVID, but we have to focus on the use of masks. I don't think we can discard the use of masks.
Okay, thank you. I think, in fact, I wanted to ask a question. This question has come from the floor itself. I will keep it till the end. To begin with, I have a question here. It's a very pertinent question about vaccination in pregnancy. I think all these days it was a no, and suddenly government changed the policy, maybe because of the scientific evidence they had. And what is the current status about pregnancy and lactating women having vaccination? Quickly, Nambi, I think we have probably 10-15 minutes. Is that right, Bhavani?
Yes, sir. Yeah.
Okay. Yeah. We have 2-3 questions to take. Another 10 minutes. Yeah. Fine.
So we do that. Lactation, I don't think there is a problem. Definitely. So if you ask any other expert, probably even 1 year before also, lactation, they would have not said no to a COVID vaccine. Why? Because the amount of vaccine that would be excreted or secreted into the breast milk is actually very minuscule. So if there is 100 units in the blood, probably 2% of it would get secreted into the breast milk. So there is clear-cut recommendation from the Indian government to say that lactating females, it is safe to take vaccine. But when the vaccines were introduced, they didn't approve its use. That is basically because it's a new vaccine. It has never been tried in that population of pregnancy and lactation. But there has been research or experiments or trials conducted in the US where pregnant individuals have been exposed to vaccines, and they found it safe both for the mother as well as the baby. But still it is early stage. I would put it that way. It's not like that we have vaccinated around 10 lakh pregnant females and then we are very clear regarding that. But we have enough reliable information available around the globe which gives confidence for medical professionals like me as well as professional societies to recommend regular use of vaccine. A definite yes in lactating female, in pregnancy also. What made the government change the recommendation for pregnant individuals is there was a huge difference between the first wave and the second wave with respect to COVID in pregnancies. So in the first wave, most pregnant mothers never had complications with COVID. The overall mortality rate was 0.7%. Whereas with the second COVID wave, it was totally different. We had a lot of pregnant ladies getting admitted with severe pneumonias, getting admitted into the ICUs. So the mortality, what was 0.7% in the first wave, had jumped up to 5.5%. And pregnancy has become a risk factor for severe COVID disease with the second wave, the new Delta variant. So that made the government change its overall approach towards approving the vaccine use in pregnant individuals. That was primarily dictated by the second wave, where the mortality in pregnant individuals was much higher than the general population. That was the main reason. And there is enough information to say that it is safe during pregnancy and definitely very safe during lactation.
Okay, there's another very practical question. I mean, we all know that millions of people around women in India were affected by COVID. When do you advise vaccine for them? Is there any different policy for them? Like, 1 dose, 2 dose? How long do they wait till they get vaccinated? Should they get vaccinated?
I would say that whether if you have had COVID, you are naturally infected, so you would have definitely natural infection-induced immunity without any doubt. In general, the natural infection-induced immunity is expected to last till 3 months after the onset of infection. So up to 3 months, it's very unlikely that we are going to get reinfected. Even if there is a reinfection, since we had a natural infection, your immune system is primed enough to tackle a new version of the virus much more efficiently than a person who's never had COVID. Having said that, if you look into three sets of people. One is someone having vaccine and then they develop an immunity, and someone who has natural infection and then have immunity. And then you have a third set. You have had natural infection and then you have taken a vaccine. So if you look into the amount of immune response, someone has taken the vaccine alone, someone has had the infection alone, and someone has had the infection followed by vaccine. The infection followed by vaccine, they have always had the higher amount of antibody response and immune response. So that was the reason why there is universal recommendation throughout the world. Even if you are infected, once you cross 3 months after your infection, where you expect your natural infection induced immunity to wane, you take the dose of vaccine. So how many doses of vaccine? That's the question. So 1 dose on paper seems to be good enough to produce good response if someone has had a natural infection. This is an evolving area. Right now, the practice is whether you've had an infection or not an infection, go with the 2 doses. Someone is infected, 3 months later, you take the vaccine. If it is Covaxin, you would do 2 doses at 4 weeks. If it is Covishield, you would do 2 doses at 12 weeks interval. Probably as time evolves, if we have more information, this vaccine recommendation of 2 doses post natural infection may change to 1 dose, but right now it is 2 doses.
Okay, this is nothing to do with vaccine. It's an interesting question what exactly President Mr. Arun was referring to. During this pandemic, we saw a lot of fake news going around virally more than the speed of the COVID virus itself. It's one of the myths. There's a question here, which is, are CT scan really a must? And too many WhatsApp messages will create mental stress. I believe what they mean is the CT scan causing mental stress or going through the COVID causes mental stress. However, the question is, are CT scan really a must? Does it cause mental stress?
I think CT scans in the majority of COVIDs is not required. So what is very important is we have to understand that in the majority, COVID is a mild infection. If there are 10 people with COVID, 8 will recover on their own. All they require is rest, hydration, paracetamol. And 80% of people with COVID will get better on their own anytime between day 4 to day 7 of illness. And this is a fundamental fact, irrespective of whatever be the version, let it be alpha, beta, gamma, theta, whatever it is. What we have to understand is 80% of them will get better on their own. In general, most people do not need any investigations like blood tests or scans in the initial 5 days of illness. If the illness gets better by day 5, there are no tests required. Only when the illness gets prolonged to day 6, day 7, in terms of persistence of fever, or there is a lot of cough, or if there is giddiness, a lot of fatigue, or there is breathing difficulty, that is when you may require other blood tests like CRP, D-dimer, or a CT scan of the chest. Up to day 5, in the majority, you don't need any blood tests and you don't need a CT scan also. But a COVID PCR is a must because for infection control purposes. So if someone has, he cannot be allowed to roam free in the society as well as in his family. So anyone with fever, get a COVID PCR done, PCR positive, all you need is self-home isolation in the majority with rest, hydration, paracetamol. If things get better by day 4, day 5, Okay, game over. If things are not getting better, day 6, day 7, seek medical care in terms of further investigations and treatment options.
And the last question, Naveen, I wanted to ask you this question. Coming to what is called health economics of the whole disease, we see that as three aspects, especially the disease and the vaccine. Number one, the lockdown causes a lot of economic disruption. We saw the economy of the country going down, dipping down to the minus, it is retracting to minus 23% in the first wave. The second wave, fortunately, to minus 7. Fortunately, coming up more than quickly what we expected, more than a hockey stick, we thought it's a V-shaped recovery. Every lockdown causes loss of economy, number one. Every time you get a wave, are we going to, or you, because as an infectious disease specialist, are you going to recommend the administrators to go for a lockdown? Number one. Number two, the cost benefit ratio of vaccination. We were talking about herd immunity by vaccinating 1.35 billion people and the amount of money involved and the amount of money in treating this group of patients if we don't vaccinate. Number three, money involved in the vaccination business itself. I'm talking about pharma industry. Can you take this question quickly one by one, coming to the health economics aspect? Because I'm sure that a lot of people here in the industry would like to know, the money involved in all these things.
I think the crisis has taught us one good thing: focus on the basics. So if you look into it in India, we look into the West, you look into UK, Europe, and US, and that's not the right thing to do in handling a pandemic. So we should look into the East. We need to look into South Korea. We need to look into Japan. We need to look into Taiwan, Thailand. We need to look into Cambodia, Vietnam. Look at the way they have handled the pandemic. March 2020, Thailand, Taiwan, Japan, South Korea, they all had more infections, more number of cases than India. And now if you look into the number of cases these countries have, it is actually less than even Chennai, even Tamil Nadu. So that is how it is. How is that these countries, the Far East countries, have controlled this pandemic? That is nothing, sheer public discipline, consistent use of masks. Vaccines came now. They controlled the first wave effectively, and they have done it beautifully in the second wave also. That is all because of public discipline and etiquette in the public social life, and then consistent use of masks and hand hygiene. They just focused on these two aspects, all the Far East countries. Countries which did not use masks, countries which did not focus on hand hygiene, it will be the UK, the entire Europe, US, India, they all suffered. India is the worst affected country in Asia. So China started, but where does China stand? The number of cases in China is less than the number of cases in Chennai. So this is the real truth, whatever we have. So how is that they were able to do it? That is because of public behavior. China had public behavior plus mass vaccination. China has vaccinated more than 1 billion. That's the highest in the whole world, actually, whatever vaccine that they have. But if you look into Japan, Cambodia, Vietnam, Thailand, these are the countries which depend upon tourism, but they focused on public discipline and consistent use of masks. Vaccines now they have added. So that answers the first question. So even if there is no lockdown or lockdown, the public behavior during or inter-lockdown periods would determine whether a lockdown would come or not. You see now there is revenge traveling. There are people flocking on to multiple places. They want to go on a vacation. They want to compensate for what has happened during lockdown. And I don't see it set right. Why? Because only 5% of the Indian population has received 2 doses of the vaccine. So there is a majority of the population who's not taken 2 doses of vaccine. And with that, if you're going to go for revenge traveling, revenge vacation in the ensuing 2-3 months, then we are staring at another wave. And then you're looking at lockdowns. Lockdowns are not a good measure in the overall future, if you look into the economy of the country. But whether lockdown would come or not depends upon how we behave during the inter-lockdown periods. Time is to act now. So if we behave maturely now, then we may escape. Take vaccine now, use mask. If you do that consistently for the next 6 to 8 weeks, then probably a lockdown will not come. If you don't do that, then you'll have to take the cane and then follow the rules. And that's the first question. Second question is with respect to the pharmacoeconomics, the cost benefit ratio. This is a global problem. It's not something localized to one particular city or one particular region of the country. So if you look into the cost of treatment of COVID, cost of treatment of COVID associated complications. Now you have people with mucormycosis, the black fungi coming on. Many people take so much time to recover, the loss of lives, the money that is spent in hospitalization. Even if it is in a government hospital, government is going to fund it. Government is to pay out of its pocket. From where does the government pay? It comes from our taxes. So in a way, it's going to add, let it, even if the patient pays or the government pays or the insurer pays, ultimately it's going to be public money, definitely. So the cost of the vaccine and what is being spent, I don't think there is any comparison because it's a global problem. So that cost benefit, whatever analysis we do, since this is a disease that cuts across all sections of the society, top class, middle class, the lower class, all regions of the country. There is no city in this whole country that has escaped COVID. So I think there is no doubts regarding the expenditure that the country would incur on the vaccination. I think we should do that to minimize the cost that would be on COVID, the COVID associated complications. That amount is huge. And the third question, sorry, Dr. Balaji, I lost hold of it.
About the vaccination industry as such, do you think this has made a the industry as such very profitable because of this? We talked about converting adversities into opportunities, converting challenges into profitable situations. Do you think this situation has made the pharmacy industry or the vaccine technology, vaccine industry a very profitable one?
Definitely. The shares of these companies have gone many-fold high. And unfortunately, the problem here is the governments have not focused on vaccine research for a number of years. The Indian government has not focused, any government, let it be UK, US, none of the governmental organizations have the bandwidth to do it. So that's the problem. So it is being done by private pharma industry. And when they do it, they would always do for profit. So that is where it stands. But we need those vaccines. And how do we get it? So we'll have to pay for whatever amount. That is where the government has to pitch in trying to have some kind of a profit ratio. So I'm not sure regarding what is the cost price of these vaccines. If it's going to be 100% more, definitely I don't think that's the right thing to do. It should be 10% more or 20% more. So something like that. So there has to be a plain, straight talk between the pharma industry and the probably associations like this could mediate that talk between the government agencies and the thing, and then look into minimizing the profit margins for whatever it is, because there are problems. The public at times loses faith when the same vaccine is given as a free thing in the government, and then you'll have to pay X amount in some hospital, X amount, Y amount in some hospital. There is always questions asked. So that's a problem. But we have to acknowledge the fact that the private pharma industry has roped in their bandwidth with respect to research potential to come up with something in a span of 8 to 10 months. So we have to appreciate the fact. But at the same time, if you look into the larger global picture, we have to look into ways to curtail the profit margins so that the benefit reaches the majority.
Thank you. Wonderful, lovely talking to you. I think the discussion and has carried on with a message which is loud and clear. I think as we stand today, vaccine is the only way where we can take a shield from the disease, COVID. And, there are whatever vaccines available today in the market are safe. I think people should go out and vaccinate themselves so that we can put a full stop to the spread of the disease and avoid multiple waves. I think made it very clear that everybody should take it, and there is no absolute contraindication except in one small group of patients who are allergic to vaccine. And I hope the message goes around the whole of the society and they get benefited. I enjoyed your presentation. Thanks for answering my questions very clearly. I am sure I benefited a lot. I'm sure all the viewers would have been benefited. Thank you so much. Thank you so much, Navi. Over to you, Bhavani.
Yeah,
Most
thank you,
welcome.
sir.
Thank you.
Thank you, sir. It was excellent session. Actually, I got answer for many of my questions because my whole family was down with COVID a month before, and now like everyone got recovered. It was an excellent session, doctor. Thank you, Dr. Balaji and Dr. Sendhu Nambi. That was a wonderful session and highly informative. Thank you, participants, for joining this session. To know more about our activities, requesting you all to visit our website, ck.in. Thank you once again and happy evening to all. Thank you, Doctor. Thank you, Doctor.
Thank you. Thank you, Bhavani. Thank you, Navi. Thank you.
Thank you. Thank you, sir.
Welcome. Bye. Yeah.
Thank you.